All right, great. So we're getting ready to do one of our favorite procedures today. This is called SmartLipo. So this is laser-assisted liposuction, and it's really effective at taking care of areas of troubled sites where there's fat, where you can diet and exercise, but they're just stubborn and they just don't seem to go away. So this procedure is really good at helping people to get rid of that, and it's done in two steps, but all in the same procedure today. So the first step is we like to mark out, sort of like a map, the areas that I see and that the patient sees as well that we want to try to get rid of. So, sorry, this kind of is awkward, a little uncomfortable, not something you have done every day, but it's very helpful because when you lay down, when you lay down, everything kind of changes, and so it's obviously best with you upright. So what I'm thinking about in my mind as I'm doing this is the areas in which we have the most fullness and the areas where there seems to be a little bit of excess skin, because the laser component can help to tighten up some of the skin. It's not a replacement for a tummy tuck, but it can help in a lot of situations. And so the people most commonly complain about this area right here in the lower abdomen, and then we have an area centrally here too that we can help with. And occasionally we can even come in with the laser and help to almost mimic a six-pack, so we can sort of use that to help tighten the skin in that area. It's not perfect, but it helps. It helps a little bit. So these are kind of the areas that I see. Is there anything else that bugs you on the tummy that you want to try to focus on?
No, that looks exactly right.
Okay. So I think, yeah, that's good. I mean, because overall you have a nice silhouette. I don't think you really don't have much at all on your flanks, which a lot of people do.
Yeah.
And we would target that separately. But I think today, if we can thin these areas out for you, it will really help. So.
I really appreciate it.
Good. Okay, great. So now we have made the entire abdomen area that we wanted to treat numb. And so we're ready to actually do the laser part. The laser does a few things. It will help to break apart the bonds in between the fat cells and help to actually break apart the fat cells themselves using heat and other energy. And so we use these little sites that we've already made for the numbing medicine. And this instrument just goes under the skin, and we control it with a little foot pedal here. There's 3 wavelengths that we use on the laser, and each of them does something just a little bit different, but the components are breaking apart fat cells, creating heat on the underside of the skin to tighten it, and also to close down little capillaries so that we have minimal bruising and swelling. So I'll kind of give you a sample for what this looks like when we actually do it here. Hear a little funny beeping sound as it's working. It shouldn't have any pain, and it's under there doing its job. And we keep track of how much energy we use in each segment, and then I make that symmetric in each component. Good. Okay, great. So we've now finished all of the laser treatment part of the SmartLipo process, and so the next thing is to actually go back and physically vacuum out and remove those fat cells, which we do with traditional liposuction using the same little 4 sites that we have here. And shouldn't have any particular pain with it at all, just kind of moving it around a little bit. And we use different sized cannula instruments here based on the site that we're working on. Okay, so I'll show you how this works here. Okay, so this instrument then we have inside the actual pocket of fat that we're trying to vacuum out. And I just move the instrument back at sort of a controlled rate and at different angles. And again, it shouldn't have any pain with that. It just feels like kind of a deep massage, or occasionally tickle a little bit. And we just keep doing this until you kind of feel like you get to the end point where there's really no other fat that we want to get out. The important thing is not so much what you remove, but what we leave behind, so that we get a nice soft contour. And then once we finish this part, what we'll do is put 1 stitch at each site, some gauze and some compression, and she'll walk right out of here and be done.